If you broke your tooth, would you know what the options are? If you break your tooth and it's kind of small, you might be able to put a filling in there, or if a portion of the tooth breaks off, you might be able to put a crown on it. But what happens if the whole tooth breaks basically at the gum line? I've been seeing a lot of broken teeth recently, so I thought it would be something for us to talk about. I'm Dr. Scheurer and I'm here at Tranquil Dental. So this in particular happened in this case. The tooth actually broke off right at the gum line. So you can see here in the x-ray that that tooth is missing. The root is still present up in the bone, but the tooth itself, the top part that's in your mouth, is completely gone. So in that type of circumstance, certainly you could save the tooth. You could do a root canal on that tooth and put a post and core on that tooth to give it some structure for a crown to go on top of it. But you have to have enough tooth structure for the crown to be able to hold on to. So there's been research that shows you need to have at least 2 millimeters, if not more, of tooth structure on the cheek side, as well as the tongue side, for the crown to be able to hold on to. So if the tooth structure is literally off at the gum line, then there isn't that structure that is needed to be able to hold on to. You don't have the height on the cheek side and the tongue side to be able to hold on to. So in that circumstance, you could have a type of gum surgery called crown lengthening surgery. So here's that tooth again. And so what that would do is take the gums and the bone up a little bit so that more tooth structure is now sticking up out of the gum line, and you have more to grab onto, and you have that 2 millimeters or greater of tooth structure on the cheek side and the tongue side. So in order to save the tooth, you could go through that process where you have a root canal, a post and core, a crown, and gum surgery to give you that tooth structure to grab onto, or your other option would be to extract the tooth. If you take out the tooth, what are your options for replacing the tooth? Generally speaking, when we have a tooth that we lose, we always want to replace it, and we have 3 options generally for replacing it. One is with a removable partial denture, so something that comes in and out of your mouth. So every evening before you go to bed, you take it out, but in the morning you can place it into position. So it's there for appearance sake and for function. The other option, the second option, is a bridge. And what a bridge is it is a crown on the tooth in front of the space and a crown on the tooth behind the space with an artificial tooth in between. And that artificial tooth is actually attached to the 2 crowns. So the same way that a singular crown is cemented into place, these 2 crowns are cemented into place with that artificial tooth attached, because it's all one piece. So it's kind of like the bridge that has the support of the 2 bodies of land, and then is going over that body of water. So that missing tooth is in that space where the body of water is. So that is cemented into place and stays in place. You can't floss in between those teeth because they are attached. And you do have to make sure that you're cleaning up underneath there. The third option would be to have an implant placed. So the implant is actually placed up in the bone and allowed a chance to heal, and over time and healing, eventually a part is placed on that implant and then a crown on top of that part. And so through that process, you now kind of sort of grow a new tooth. When you bite down on that tooth, those forces go up into the bone from that implant. So you're not asking the teeth on either side to do any more additional work like they would be with either a partial denture or with a bridge, but the forces go straight up. And you can floss in between there too. So those are the three options: a removable partial denture, a bridge, and an implant if you're going to replace the tooth. If you want to try and save the tooth, then it's going to require some work because there's not enough structure there to grab onto. So if you have any other ideas of subject matter that you'd like to go over, make sure that you give me a shout out, tell me hello, and let me know any other ideas that you'd like me to go over. If you have a lot of stress in your life and you happen to break a tooth, you'll now have a little bit more of a sense of the options.